Now, to continue the discussion about where we are 2 years removed, happy to have back on the show Dr. Syed Hussain from Trinity Health of New England. He's joined us every Friday morning for a long time now to talk about the latest news, trends, concerns. You ask, we answer, you name it. Doctor, thank you again for joining us right now. Why don't you just start by telling us what you think the biggest difference is as to where we stand now 2 years later compared to where we were 2 years ago to the day?
So morning, Tim. So we've lived through truly historic times. We've come such a long way. And I can describe that really quickly in three important arenas. We've made tremendous progress. First and foremost, safe and effective vaccines. Second, the advent of so many therapeutics, including those for the more vulnerable immunocompromised individuals in our communities. And third is more ramped up testing. All three aspects will position us better to withstand any future surges, knowing fully well how this virus has behaved over the last 2 years.
A lot of people have heard the word endemic, the point where the virus is circulating at a constant but relatively low level like a lot of other viruses are. How close do you think we are to that point?
So one thing we've learned over the last 2 years, it's really hard to predict what this virus will do, but most likely we are heading towards that endemic stage where it will become like the influenza or a common cold virus and may become seasonal. And the reason why I say that is because viruses tend to last longer in the winter, and folks tend to be, obviously because of the colder temperatures, more indoors, which means it's a perfect scenario for more transmission, more spread, hence why we see influenza during the cold season. And this may hold true for COVID-19 as well. Time will tell.
There's that old saying, those who forget history are doomed to repeat it. This is by no means the first pandemic we've faced in the United States. It's not going to be the last. What do you think we have collectively learned that we can take 10 years from now, 20 years from now, when the next pandemic, whether it's flu or otherwise, comes around?
So what hasn't changed is the importance of public health measures. The distancing, masking, although they seem very basic, really do save lives. In addition to ramped up testing, we need to ensure that we follow healthcare leaders and public health officials as much as possible to guide us through an eventual pandemic, which will happen, no doubt, but we need to be better prepared.
Okay, well, we will see when that time comes. Also very curious, and this isn't a question because we're out of time, but I'm just curious to see next winter, if COVID is not ramping up again, just how many people get out and wear masks because it has now just become part of their winter routine like it is in Asia and a lot of other Asian countries. Doctor, thank you so much for taking the time to join us here on this 2-year anniversary.